from the News Channel 5 network. This is Urban Outlook.
Hello and welcome to Urban Outlook, a forum for African American issues. I'm April Eaton. Thank you so much for being with us today. You know, the coronavirus pandemic is impacting the entire world, but here in the United States, there's a disturbing trend that's showing up in a number of cases. People of color, particularly African Americans, have an increased risk of contracting COVID-19 and dying from it, more than white people. What's driving this health disparity? What can we do as a people to stay healthy and stay safe? Joining me to discuss this trend is Dr. Calvin Smith. He is a physician and a professor at Meharry Medical College, and he is the supervisor for COVID-19 testing throughout Metro Nashville and Davidson County. Thank you so much for being with us, Dr. Smith. You are a busy man.
Good morning, April. Thank you.
You are a busy man, so we appreciate your time. As I said, you have been making sure that we've been doing the right things at testing centers across Middle Tennessee, so your time is valuable. But also, I want just to talk a little bit about what you're seeing out there. These numbers, this disparity that has sort of arisen through this pandemic that shows that African Americans are getting the disease and dying from the disease at a greater rate than whites.
Yes.
What do those numbers look like?
Well, thank you for having me, April. And real quick, I just wanted to correct something because I don't want to take undue credit. I'm the clinical lead for the Nissan Stadium site. I don't have the entire Middle Tennessee, thank goodness.
Okay.
I don't know if I'll be able to handle it.
Thanks for that clarification. That's a big
said,
site on its own, so thank you for clarifying there.
Well, I got to give Dr. Farmer-Dixon and Dr. Gray their due because they're the ones that hold that position. But at any rate, yeah, we've seen that this disease does have some disparate numbers in terms of both the number of people who are being affected by it, who are Black or Hispanic, and then the number of people who are having severe outcomes, i.e. dying from this disease.
And why is that? What's happening? Sorry, I didn't mean to cut you off
Two
there.
major things that are occurring. No, you're fine. Two major things that are happening. One is that a large number of people of color, African Americans and Hispanics specifically, are already predisposed to having diseases like high blood pressure, diabetes, and those that have those comorbid conditions, those things that go on simultaneously, tend to do worse with the disease. So there's that one aspect of it. The other is an issue of public health, which is access to care. And, you know, with COVID, what we're finding is the quicker that you come in and deal with the issue, deal with the symptoms that you're having, the better your outcomes. And the better facilities you have, the more access to things like, you know, some very high-tech advanced forms of critical care, the better your outcomes. And it's just, you know, people of color, African Americans, Hispanics, and especially those in low socioeconomic areas, don't have access to those things. So when they do get COVID, it's a downward spiral for a lot of them.
That's interesting that you talk about the lack of access to proper care. And one of the other studies that's out that I'm sure you've seen has to do with Pew data that uncovered that African Americans are significantly less likely to get the COVID vaccine. We know that medical officials are frantically working to come up with a vaccine that will help protect us moving forward. But this study shows that because of the lack of care and also because of some old taboos about being the guinea pig when it comes to testing, that African Americans might not even get the vaccine that they need to protect them.
Yeah, and it's rooted in some truth. I mean, we can't deny the fact that in the past, African Americans have been used as guinea pigs, such as in the Tuskegee experiment. Even here in Nashville locally, there were some issues with some of the testing done for various issues with heart disease and things of that nature, where African Americans have been devalued as human beings and used as guinea pigs. And so, you know, now as a result of that, there are a lot of people that don't trust the system. And, you know, a big part of what we're trying to do is to rebuild some of that trust here at Meharry Medical College and other institutions like us. So you're right. I mean, when the vaccine, and I'm sure a vaccine will come, when it comes, we don't want to be the first in line for it. And when we really should probably be the first in line for it, given how many of us are affected by it.
So with that, with those things that are sort of stacked a little against us, let's say. The fact that we've got these issues that are more prone to getting the virus. And then on top of that, we're dealing with the disparities in health care. What can we do to keep ourselves safe and healthy as a people?
First and foremost, we need to continue to wear our mask and continue as much as we can to adhere to social distancing. The curve flattened for a reason, and it didn't flatten to the numbers that we would have liked. And we're seeing peaks again. And I wouldn't even necessarily blame the protests because it's too early to see that kind of thing. I think it's more from the states reopening, into their different phases. But we're seeing that those peaks are still occurring. So it's imperative that people wear masks. I know there was a study that came out that shows that asymptomatic people may not be the ones who are transmitting as much, but we don't know that for certain. And when it's uncertain, I think we should err on the side of caution and continue to wear masks and really try to do our due diligence to make sure we are doing what we can to not spread this disease.
There was an interesting article that I read recently, masked versus unmasked. And there seems to be this trend, this phenomenon, where some people really believe in protecting not only themselves, but protecting those around them by wearing their masks in public, by doing the social distancing, by making sure they have gloves and hand sanitizer, that kind of thing. But there's a whole group of other people who think it doesn't matter. So how do you deal with those sort of, that disparity there in wanting to wear the mask versus not?
Well, I think, the biggest thing is to get truthful information out and not information that necessarily we want to hear or don't want to hear. I did not, for instance, want to hear that asymptomatic people may not be the main carriers of this disease, for instance. But, that was an article that was based in some research and some study. And listening to people who are experts, listening to people who are out in the field dealing with it, listening to people who have access to those kind of people really can make a big difference. A lot of the information that we get, for better or for worse, is via social media and via our echo chambers, people that think the same way that we think. And I think a big part of that is to listen to some of the outside voices and to understand why they feel the way that they feel. Once you do that, you can address those issues and you can kind of make a change. But you have to be able to at least hear things that you don't necessarily want to hear and be open to it.
The numbers, of course, of cases, of COVID-19 cases change every day. We see the peaks, we see the falls, we see the leveling out. I think there were at least 20 states that actually saw an increase recently since June 1st. What do you think is happening here, where we're still seeing states that are raising those numbers? Is it that more people are getting out and about, they're feeling more comfortable to get out and about, or some of the recent protests that we're having, are those causing the numbers to spike?
Yeah, I think that it's the former that you mentioned. I think more people are getting out and about with the reopening. The government endorsed reopening of a lot of the states. I think that the numbers, statistics tend to lag behind. And so it's a little bit too early to see, number one, patients that are symptomatic of COVID from the protest. There are people who probably have it brewing or incubating and will probably be testing positive for it here in the next few days. But generally, I think the spikes that we're seeing right now are more related to the states reopening. I'm pretty sure that the protest will then add an additional spike to it. Don't get me wrong. But I think what we're seeing right now, any form of congregating without masks in particular, will show that we'll have spikes. And in the states that we see those spikes in are almost by and large those states that reopen.
Dr. Smith, as you see those things happening around the country, does that concern you even more about our ability to sort of get a grip on the coronavirus?
Oh, absolutely. When I see the footage, when I watch the news coverage, I cringe. And I cringe not because of what's happening, because I think it's, in my opinion, a righteous cause for a lot of people.
Yeah.
I cringe because the people I see are not wearing masks. I come from a culture, my college, Meharry Medical College, is very much in support of and has a history of being people that are supportive of protests. We've been freedom riders. We've been a part of SNCC, the various units of people that have been protesters in the past. And we endorse that. Dr. Hildreth sent a letter out to the faculty saying, don't be afraid to be an activist. But when you are an activist, don't be a vector. Wear your mask. And I can't stress that enough. I want to see the footage of it. I want to see people wearing masks and protesting peacefully.
Makes sense, all the sense in the world. Let's take a quick break, and when we come back, Dr. Smith, I want to talk about sort of the work that's going on there at Meharry to kind of find this vaccine. We'll be right back after this.